So in terms of the impact on our clinical practice, I think undoubtedly the major change has been the transition from face-to-face consultations to telephone or telemedicine consultations, and this has really completely changed the way we operate our clinics. So a lot of patients have been very happy with telephone consultations, particularly during this period. And I think, in response to your second question, I think that this is going to actually change the way that we run our clinics after the COVID-19 pandemic, that we're going to transition a lot of outpatient appointments to telephone consultations. So, and then in answer to the question regarding the impact on patients, for a lot of patients that are actually on follow-up, as I mentioned in the answer to the first part of the question, I think a lot of people have been happy with a change to telephone consults. So that's not really impacted patients that much, and in fact has probably made things a little bit easier for them. In terms of the impact on patients that are actually on treatment, for a lot of our patients that are on oral treatments, very little has changed in terms of the administration of the drugs, but some of the nuts and bolts of follow-up and toxicity checks has changed, i.e., the change to telephone consultations. But there has been a change for our patients on intravenous therapy, particularly patients receiving palliative intravenous therapy, where we've tried to either give people a break, a holiday off treatment, or extend the intervals in order to try and reduce the risk of exposure to COVID-19. So there's almost a full spectrum in terms of the impact of this pandemic on our patients, from very little change to a change in terms of the treatment schedule. So I think the lasting impact of this will be a significant change to telephone consults.